High blood pressure, also called hypertension, and unusual lipid levels including high cholesterol and triglycerides, are two big risk factors for heart diseases. Studies have shown a strong connection between high levels of cholesterol and triglycerides and a greater chance of getting high blood pressure. Cholesterol is a fatty material that's really important for building cells and making hormones. It's needed for your body to work right because it helps make cell membranes, some hormones, and vitamin D. Cholesterol travels in your blood carried by lipoproteins, but when you have too much low-density lipoprotein, which is often called bad cholesterol, it can build up in the walls of your arteries and form plaque. This plaque buildup can block blood flow and increase the risk of heart problems, like heart attacks and strokes. This process, called atherosclerosis, makes arteries narrower and less flexible, so it's harder for blood to flow. Over time, this can cause big health problems, including long-term high blood pressure and other heart conditions. Because of this, the heart has to work harder, which raises blood pressure. This extra work can make the heart weak over time, and it could even lead to heart failure if it's not treated. On the other hand, high-density lipoprotein, or good cholesterol, helps remove extra cholesterol from the blood. This lowers the risk of plaque buildup and helps keep blood pressure at healthy levels. HDL acts like a cleaner, taking LDL cholesterol away from the arteries and back to the liver, where it's processed and removed from the body. When HDL is low and LDL is high, the risk of high blood pressure goes up a lot. It's really important to keep these two types of cholesterol balanced for a healthy heart and overall well-being. Triglycerides are another kind of fat in your blood. They're your body's main source of energy, but if you have too many, they can cause problems with your metabolism and blood vessels. Studies show that high triglyceride levels are often connected to insulin resistance, being overweight, and inflammation, which can all lead to high blood pressure. Too many triglycerides can cause endothelial dysfunction. That's when the inside lining of your blood vessels, called the endothelium, gets damaged. This is a major factor in heart diseases. When the endothelium isn't working right, blood vessels can't widen like they should. This means they can't expand to let enough blood through. This increases vascular resistance, which is how hard the blood has to push to flow through the vessels. Higher resistance makes it harder for blood to move around. As a result, this increased resistance makes it tougher for blood to flow smoothly, which raises blood pressure. High blood pressure is a big risk factor for heart disease and stroke. Also, high triglycerides are linked to a higher risk of blood clots, which makes heart problems even worse. Blood clots can block blood flow, leading to serious problems like heart attacks or strokes. When both cholesterol and triglycerides are high, the risks add up, making things much more dangerous for your heart. The effect on blood pressure can be even worse, leading to long-term high blood pressure that's hard to control. Stiff arteries, inflammation, and a damaged endothelium all combine to create a really bad situation for your heart. These things together make high blood pressure worse and worse over time. In the end, this increases the risk of heart disease, stroke, and other serious problems. This shows how important it is to manage your triglyceride and cholesterol levels for a healthy heart. Keeping your cholesterol and triglyceride levels healthy is super important for preventing high blood pressure and lowering your risk of heart problems. High levels of these fats can lead to plaque buildup in your arteries, causing blockages that can lead to heart attacks or strokes, so it's really important to keep track of these levels and manage them in different ways. Some important lifestyle changes include healthy diet, eat less saturated and trans fats and eat more fiber, omega-3 fatty acids and lean proteins. Eating more fruits, vegetables, whole grains and nuts can also help keep your lipid levels healthy. Regular exercise. Being active helps improve lipid levels and keeps your blood pressure healthy. Try to get at least 30 minutes of moderate exercise like brisk walking, biking, or swimming on most days of the week. It can make a big difference. Weight management. Staying at a healthy weight is easier on your heart and blood vessels. Reaching and staying at a healthy weight by eating right and exercising regularly can really lower your risk of problems caused by unhealthy lipid levels. Limit sugar and refined carbs. Eating too much sugar can lead to high triglycerides and problems with your metabolism. Choosing whole foods and cutting back on sugary drinks and snacks can help manage your lipid levels. Medication. When needed. Sometimes doctors might prescribe statins or other medicines to help lower cholesterol and triglycerides. These medicines can be really important for people who can't control their lipid levels with lifestyle changes alone. There's a clear connection between high cholesterol, high triglycerides, and high blood pressure. Managing lipid levels by changing your lifestyle and, if you need to, taking medicine can be really important for preventing high blood pressure and lowering your risk of serious heart problems. By understanding this connection, you can take steps to keep your heart healthy.